Hello, my name is Janie Umstadt, and I am a family nurse practitioner student at Texas State University. Today, I would like to discuss a matter that negatively impacts the fluidity of hospital admission for patients. Working alongside doctors and nurse practitioners in the hospital setting, I have first-handedly witnessed barriers to providing patients with quality care due to faulty communication and conflict that arises from the lack of authority nurse practitioners have when it comes to hospital admission. The subject I am presenting today discusses the lack of privileges the nurse practitioner has in independently admitting patients into the hospital. The Joint Commissions on Accreditation of Healthcare Organizations assert that the medical facilities must credential APRNs using the same privileging process they use for physicians. Though this holds true, the current standards allow hospitals to designate APRNs as less than active medical staff and therefore are not recognized as official staff members. The individual hospital must grant the APRN specific rights in order for the APRN to be able to admit without permission from a doctor. Due to this loophole in the guidelines and the fact that only current hospital staff members are permitted to admit patients, APRNs are often left without the ability to admit patients into the hospital. While it differs in many states, Texas hospitals are not required to grant APRNs these privileges and further have the ability to revoke these rights. A standard policy needs to be in place to trump individual facilities' bylaws that control what eligibilities the APRN has. This creates inefficiencies in the hospital setting in that the APRN must contact the doctor, give report on the patient, which includes their medical history, tests completed, radiology and lab results, admitting diagnosis, and reason for admission. From there, the overhead doctor must approve the admission, and although not serving as the primary provider, the doctor's name must be on the order. This devalues the meaning of what it is to be a nurse practitioner. We are trained to recognize when a patient needs further care, and we are able to independently treat, diagnose, and prescribe future treatment plans. Adding an incremental step only lengthens the process and creates opportunities for poor coordination of care. While this is demeaning to nurse practitioners, it is also a poor use of the doctor's time. It also opens doors to lawsuits in which the doctor may be responsible for, although it was the APRN who provided care for the patient. There is a great need for APRNs to be directly embedded in the hospitalization process in order to enable for a seamless experience for both medical staff and patient. I am requesting your support for expanding the rights for APRNs in the hospital. A judicious nurse practitioner performs in favor of the patient. Being able to admit patients ourselves will assist in a smoother, safer, and more time-efficient hospital stay for our patients. Thank you for your time and consideration on this imperative topic.